Well, Health Minister Dr. Zweli Mkhize has reiterated calls for the provision of personal protective equipment for frontline workers. He says nobody should risk their lives at work during the COVID-19 pandemic. 5 months into the pandemic, the availability of PPE remains a huge concern, especially for unions who've been protesting over this issue. The minister joins us tonight. Minister Mkhize, good evening. It's a pleasure to have you on. Perhaps maybe just a roundup of where we are right now in the fight against COVID-19 and your own reflections on whether or not South Africa is winning this fight.
Well, thank you very much and good evening to you and all the viewers. At this moment, we have tested 609,773 positive cases for COVID-19. This is an indication that we still have an increasing number of people who are positive. However, if you look at the trends now, all the provinces are indicating that we are on a decline. And so we can safely say that South Africa is over the surge. However, we still have to remain very cautious because this can turn anytime depending on how we behave. At this point, though, South Africa has shown 83% of recoveries, and the numbers in every province, particularly Gauteng and KwaZulu-Natal, that were the last to start declining, are also showing very promising trends where the increase every day is just around 1,000 or a little bit less, sometimes a little bit more than 1,000. But that is a very hopeful situation. We remain very optimistic about it.
Sure. We may have the worst behind us, but it looks like for the health workers of this country, the situation has not been improving. In fact, unions have now gotten to a point where they've reached their own breaking point.
We have a serious challenge that we have to all agree about, and that is protection of health workers is paramount, it's non-negotiable, and I stand on the side of the health workers that they have to be protected, and we have therefore had a meeting with the unions and management and various provincial leaders, MECs and heads of department. We have said no PPEs, no work. In other words, management and unions must ensure that everyone is protected so that they can go and do the work having been properly trained and prepared to fight COVID-19. We really do feel that it's important for us to continue to protect the health workers, and we thank them for the work and their commitment and their diligence. And we also know we have lost some. At this point, we have lost 240 of the health workers out of the 27,000 that are positive. We do wish to convey our condolences to the families and the colleagues and the loved ones. We know how distressful it is to be losing any health worker and any colleague.
Minister, it's interesting on this PPE issue because you have always maintained that there is enough PPE in the country and that in fact all health workers are being provided with personal protective equipment. So where does the gap lie right now? Well,
the past few months we have been trying to figure out why has this been a problem. At the beginning we did have a shortage of PPEs, and that was when we had the whole world clamoring for the PPEs. That somehow has been corrected, so we are far away from that now. The real issue is availability of the PPEs at the facility level. This is affected by how the PPEs are managed and how they are distributed, how they are transported, and also in some instances the quality of the PPEs, in some instances even the sizes of the PPEs, because you find someone will say there is a PPE but it doesn't fit some of the people because of the way that it's being managed. So we have given a directive that all of this needs to be corrected, and a committee on health and safety for every facility must be allowed access to the stock level so that they can comment and decide whether the health workers are having adequate protection. We want to insist that there must be transparency in the management of PPEs by the management so that we can bring the end to this kind of complaint, particularly because we are aware that there are weaknesses in the management of the PPEs.
What role has corruption played in the inability of health workers to access this equipment that they need in order to do their jobs?
Well, we always remain very concerned about corruption. We're concerned to the extent to which any of the resources that are destined for assisting to save lives should not then be deviated for personal interest, and therefore we have to work together to fight and stamp out corruption as such. We wait and cooperate with all the investigating agents to make sure we find out what the role of corruption would have been at the level of the supply of PPEs. Right now, we think that the amount of PPEs can be affected in the situations where the cost is very high, and therefore we end up having to pay too much for PPEs that could have been bought at a lower level, or poor quality that is not protective, or at a level where there's poor distribution, mainly because the management management has been involved in corruption at that level. We are looking at all possibilities of what could the impact be. But right now, we want to make sure that at the local level, there is no discussion about PPEs. If there's any complaint, then it must be valid, and management and the unions must make sure that we solve that problem, because that committee must have equal participation from the staff and from the unions.
How quickly do you think things are going to be dealt with this time around? Because the unions have been complaining about this for months on end. So I'm just curious to know how the appointment of these occupational health and safety committees is going to change the response of the National Health Department in making sure that everybody on the ground does what you think they're doing, or even what you would expect them to do.
We have actually been discussing this issue for the past few months. The idea of occupational health and safety committees was an issue that has been raised by the unions, and we have then given a directive to make sure that this gets done. But what we have found is that it has been done in a number of areas. When we came together to look at it, we found that there are still a number of weaknesses. Yes, the committees are there, but some of them are not formed in accordance to the law, and therefore they don't do what needs to be done. They don't get given the authority that the legislation gives them. And some of the areas, people are, the leadership is weak. They need to be trained so they understand their roles. And in other areas, it depends on who's dominant. Is it management? Is it trade unions? All of this has to be sorted. We've given them 10 days to show us consequence management where the actions have not been followed properly.
Do you think that you've been able to persuade the unions enough for them to hold off on their threats for a strike later on this month?
Well, there is no law that would stop a strike, and the unions have the right on the Constitution to take the decisions that they take. And therefore, from that point of view, we would not deal with that issue. We just need to focus on resolving issues. What one wants to point out is that as much as the unions have got the right and the workers have got the right to protest and raise their concerns, they need to be assured that we will do everything to correct the situation, because it's a matter now where there are no two sides about it. Whether you are minister, management, or MEC, or HOD, or trade union, or health worker, we will stand on the one side. There must be adequate protection. PPEs must be made available. We will continue that fight. And then, of course, there are many issues that get to be considered when the workers decide to go on a protest. And on those issues, we would let the structures associated with them to try and resolve those issues.
All right, Minister Zweli Mkhize, we're going to continue our conversation with the Health Minister after this quick break. Do stay with us. Minister Mkhize?
Hello?
Oh, just double checking you're still there. Sorry.
Okay.
All right, coming back to you now.
Sure.
You're live on News at Prime. It's a pleasure to have you with us tonight. We're in conversation with Health Minister Dr. Zweli Mkhize. Minister, you've talked about the number of health workers who've lost their lives. A pressing issue for the unions has been the matter of danger pay and compensation that needs to be afforded to those who are putting their lives at risk during this period. What are the conversations that are taking place between yourselves and your colleagues in cabinet to ensure that what they're doing is not just going to be, you know, a sacrifice that isn't recognized by the state?
Well, we have been discussing the issue. As a matter of fact, I think, as you have rightly pointed out, it's not a matter that the Department of Health or the Minister of Health can resolve. It's a matter that does require discussion with the Minister of Labour and the Minister for Public Service and Administration. The representations are being made at different levels, and at the beginning when this matter was raised, the Minister of Labour had indicated that there is an approach that has to be taken in tabling this matter, which requires a bargaining process. Now, in our last discussion, when we raised the issue, particularly with NEHAU, we indicated that that was the response, and they felt that we need to continue lobbying the rest of the other members. And I must say that at this point, our situation is that the discussion are continuing at that level. I'm not at liberty to get to any kind of conclusion on the matter, but those various ministers are seized with the matter.
Various surveys that have been done, especially with health workers, have highlighted the extent to which many of them are struggling emotionally to deal with this period. It's had an incredible effect on their mental health. Is that a priority for the health department to support them and also to ensure that their well-being is taken care of?
It's a huge issue, actually. It's one of the silent manifestations of COVID-19 that we have never had enough time to talk about. You know, if you look at it from various elements, on the side of the health workers, the pressure of having the fear of getting infected, the anxiety that you could be infected, the anxiety that you could infect the patient, the anxiety that you could infect your own family is crippling. And the fear, therefore, is highly recognized. At the same time, the pressure of having to work with the large numbers of very sick and sometimes dying people does exhaust the health workers, creating a degree of fatigue and a sense of helplessness. And this is a major issue where we have agreed that there has to be a whole program for psychosocial support that must involve working with social workers, with psychologists, but going beyond that to even deal with the issues of spiritual counseling using the services of religious leaders and so on. It's a major issue that we have said must be at the center of our cooperation between the management and the labor unions. It's also an issue with the communities because, you know, imagine, particularly in Africa, it's very, very difficult to have a situation where relatives are at hospital, are sick, and the members can't visit them. It's a distressing issue, and it's painful. I know this because we've had members of my family who have been similarly affected, and you can't go visit them. At the same time, if somebody passes, the way of grieving is completely contrary to the normal way that we do as Africans. So, again, there's another area of psychosocial distress that we have noticed. This is something that we have to work together on a continuous basis, even long after COVID-19 has passed.
And now that you look at the situation in South Africa and see that perhaps the numbers that have plateaued in many respects, what becomes your focus?
Well, the fact that the numbers have started easing, it's what I would call a temporary respite. What we need to be very focused on is continuous monitoring so that we can pick up early if there should be any cluster outbreaks, any pockets where this infection might be arising, because that might create a resurgence which is higher than what you might have seen in other countries. It's very, very important for us to focus very strongly, as we shall be doing, on behavioral change, mobilizing communities to insist on masks, insist on wearing of masks outside the homes, distancing, cough etiquette, and all the hand washing and hand sanitizers. That becomes our major focus. It's actually given us an additional benefit that we've seen the flus and colds reducing as a result, which means in future we could actually focus on the prevention of those which can be complicated. At the same time, we're going to now be looking at the investment in infrastructure that's going to be necessary to build the future national health insurance that we're moving towards to. And therefore, I have the building of human resources, the building of renovations and maintenance of our facility, and the transformation of our facilities, use of ICT, and reorganizing the health services at the sub-district level. All of these are now what we need to create a platform from which the national health insurance will be built.
Minister, part of what we're also seeing is that out of the research that is being conducted is that primary healthcare services have been suffering, especially when it comes to people being able to access treatment for HIV/AIDS, for tuberculosis, and women being able to access services for reproductive health. Talk to me about how you're going to fix that.
Well, that actually was a major concern when we had the lockdown because of the restriction in transport and fear of COVID at the time. So we started seeing the numbers of people visiting hospitals reducing. We had to also delay some of the elective surgeries. We had to also reduce the patients in hospitals. And so ladies couldn't come in for reproductive health issues, contraception, and so on. However, when we realized that as soon as we're moving towards level 3, we were then activated again a lot of messages to go to invite our patients to come back to hospital. We've seen an improvement in immunization, in the collection of treatment on TB and HIV treatment. That actually we've already started that work, and we can see the improvement at that level. Now with the numbers as they're coming down, we have indicated that once there are fewer patients being admitted for COVID-19, there need to be a resumption of elective surgery where you screen patients and treat them early, do operations to prevent complications of diseases. So we're going to be focusing on activating all the services at that level.
How soon can people expect elective surgeries to come back online?
Well, it's going to depend now on a hospital-to-hospital basis. We're going to be asking everyone to get ready to slowly introduce these services. Obviously, the areas where there's less pressure, there will be early introduction. So if you look, for example, in the Western Cape, where the surge happened, and for the past 2.5 months, they've been on a plateau and the numbers are declining, they might start earlier than what you would expect in Gauteng and KwaZulu-Natal, because their numbers will still be putting a lot of pressure on them. And so we will go by the decisions of the heads of the departments and clinical disciplines, working together with the hospital management. But we need to ensure that all the messages go out to our people to say the hospitals are open to give them attention, particularly for comorbidities and other diseases which have been generally under control or were managed before COVID-19. Because COVID-19 is not the only cause of mortality, and therefore it's important for us to open up and increase the uptake of the regular services in the health service in different hospitals and clinics.
Given how the reallocations of budget has had to take place under COVID-19 and, the talks of South Africa, of course, having some serious financial difficulties, is the allocation for other services within the health department going to suffer as a result of all of the money that has had to go into COVID-19?
Well, fortunately for the health services, the funds that are coming in generally for the funds to be effective in dealing with COVID-19, they've got to focus on strengthening the overall health system. So where did the money get targeted to? We targeted on employing new additional human resources, so more people had to be taken up, vacancies had to be reduced, hospital renovations and equipment had to be focused on, and the additional training of the various categories of employees, creation of beds in the ICUs, bringing in ventilators, putting up oxygen connections even in hospitals that didn't have that before, oxygen reticulations and new tanks. All of these are what we will need anyway to take the health system into the future. What has happened in government, the reprioritization has happened on the different departments wherein funds have moved towards the health department. So the department on its own has invested largely at the level of improvement of its quality of care. The field hospitals were halted at this point. We've taken a view that if we need to activate the field hospitals, we will have about 4 to 6 weeks of lead time before we can get them operational, so there's no problem with them. So we're focusing on maintenance now, on refurbishment of the old buildings so that they are useful for the future. So I would say health department has generally got a balanced distribution of the resources that have been made available.
All right.